Hi guys, I'm John Mongeau from NBC Connecticut and CT Live. I enjoy making things. I like welding things, building with wood, and fixing things that I broke. But the people at MakeHaven, a makerspace in New Haven that we've had on CT Live before, they've gone a bit further. They're responding to Covid-19 by sewing masks, 3D printing face shields for nurses, intubation shields for hospitals, and even building last resort ventilators right here in Connecticut.
Hi, I'm Kate Sevick. I'm the operations manager at MakeHaven, and I wanted to mention our mask sewing program that we're doing right now. We have over 100 people who are sewing masks from home. If you want to get involved in sewing masks for our community organizations in need and our healthcare workers, you can go to makehaven.org/face mask. And so we have all different patterns that you can use. We have virtual sewing circles that we're doing to help people get their questions answered. We have no contact drop boxes where people can pick up materials and leave completed masks that the United Way is helping us get distributed. So I encourage you to go to makehaven.org/face mask to get involved. If you are not a maker or not a sewer, but you want to help out in these efforts, we also have a new program at makehaven.org/sewgood. That's SEWGOOD. And this is a program that we have launched where people can make a cash donation, and that money will immediately go to a sewer who is out of work or otherwise negatively impacted by the COVID-19 closures. And it will be in the form of an order for masks. So basically your donation becomes an order for masks. That person who is a professional who is able to make masks quickly will complete that order and then pass those masks along to an organization in need. So it's sort of a win-win way for your donation to have a large impact.
Really, as we saw that there was a ton of activity happening within the maker community, and we wanted to be sure that people were aware of what was happening, able to make connections, identify where there was gaps in material or knowledge.
So I've got one of these handmade masks, right? One of the things that I've noticed about these laces that's kind of annoying is you have to tie them every time you use them. So if you have a 3D printer and you're making masks, I highly recommend you print one of these out. I can give you the link for it if you want. But basically it just allows the straps to go together. So all you have to do is put it around your head and then pull it tight, and then it's there. So you don't have to really mess with it a lot. And if you have a 3D printer, you can probably crank 100 of these out every day if you want. So
I want to give really quick shout out to everybody that worked on the face shields for the last 4 days or so. I was volunteering at a New Haven facility that is taking care of coronavirus positive patients who are homeless and do not require hospitalization. And we've been using the MakeHaven face shields and they are great. And I was really happy to be part of a community that made that happen, and really happy that I could use them for my own safety.
We have a small group of people, makers with 3D printers, who've been making face shields at a couple samples here. I'm bringing about 200 down to New London probably Wednesday, where there's a hospital which has a need.
The AMLOVent ventilator.
For people who aren't familiar, this is based on a design coming out of Israel. It ranked really highly on a comparison of DIY ventilators, so that's why we chose it. We have been working diligently in concert with that original team to develop our own with some slight modifications. We'll be doing testing in a simulation laboratory with mannequin humans and fake lungs and whatnot to make sure that this isn't going to hurt anyone, and then we will stress test it. Just in case this wasn't totally evident, this is a last resort option. We hope doesn't get used, but we want to have it on the table so that if the day comes where it is needed, we have it already made.
Do you want to just talk about the intubation chambers? Is that sort of a related story as far as the prototyping and then now production?
And the idea is that when you're intubating a patient, that is putting an endotracheal tube down their trachea to help them breathe because they can no longer breathe on their own for whatever reason. Especially right now, we're really afraid of all of the aerosols that process produces. And so people have been making these intubation shields. So we went through a few different design iterations to come to these dimensions that work both for the beds and the patients and for the type of intubation tools that they use at the hospital. So after going through those design processes, we tested them thoroughly and then took those specifications and brought them to a manufacturer who is now making them. And so anyone can call Modern Plastics and say, hey, we want the Yale New Haven or MakeHaven design of intubation chamber, and they will get that.